Good morning. My name is Olga Dонцова. I am a 6th-year student of Kharkiv National Medical University. Today I'm going to present our work, measles in hospitalized adults during 2018 outbreak. Measles belongs to a group of so-called controlled infection. For a long time, the disease was considered a childhood infection, but the last outbreak, which covered almost all countries of the world, is characterized by a significant increase in the proportion of adult population in the disease structure. According to the official data of the Ministry of Health of Ukraine, in 2018, there was more than 54,000 cases of measles, more than 20,000 among adults. In the Kharkiv region in 2018, there were registered 627 cases, and half of them among adults. The goal of the work was to investigate the clinical features of measles in adults of Kharkiv region in 2018. To achieve the goal, following tasks were set. To study the general age, the gender age and epidemiological features of measles, to investigate the clinical manifestations of measles at the present days, and to compare clinical manifestations of disease in vaccinated and unvaccinated patients. Analysis of 99 cases histories of patients with measles who had been treated at the Kharkiv Regional Clinical Infectious Disease Hospital in 2018 was performed. The diagnosis was established on the basis of clinical and epidemiological data and confirmed by the ELISA method. Here you can see the distribution of patients by different signs. Among hospitalized person, the number of women and men was almost equal. The age of the patients varied from 18 to 64 years, and in the average was 33 years old. More than 80% of patients belong to a young age group. Almost half of the hospitalized individuals noticed that they were vaccinated against measles in the childhood. Clinical presentation of measles in hospitalized people characterized by presence of intoxication, catarrh, and exanthema syndrome. Disease was started from fever, which was observed in all patients, accompanied by headache and different body aches. Almost all patients complained on cough. Around 72% of them had pharyngitis. Almost half of patients had conjunctivitis. Rhinitis was observed in a third of patients. Complex sports was detected in 55% of patients. In 74% of cases, patients had an increase in the lymph node sites. It should be noted that unvaccinated patients had a reliable enlargement of occipital lymph nodes more often. Dyspeptic syndrome was observed in a third of patients, more often in unvaccinated patients. Macular-papular rash was observed in all patients with appearance on third day of the disease, on fourth day, sorry, of the disease. In 54% of cases it was abandoned. In 15% of cases it was accompanied by itching of the skin. There was a tendency to non-accompanied spreading of the rash. The rash of the face and neck was present in all patients, while trunk and upper extremities localization insignificantly, and more often all over the body localization, significantly more often in unvaccinated patients. Consequently, we can draw the following conclusions. The peculiarity of measles outbreak in Kharkiv region in 2018 was a significant increase in the number of adults among the sick people. Most commonly, it attacked young adults. The main value in clinical diagnosis of measles in the 2018 season, as well as during past outbreaks, had fever, cough, conjunctivitis, maculopapular rash, and Koplik spots. Difference between the majority of clinical signs in vaccinated and unvaccinated individuals was insignificant. However, the classic stage of rash with its spreading all over the body, dyspeptic syndrome, and enlargement of occipital lymph nodes was significantly more frequent in patients who had not been vaccinated. The fact that almost the half of the adult patients had anamnestic data about previous vaccination against measles is likely to indicate that age-related immunity tends to decrease and results in necessity to review adult vaccination approaches. Thank you for the attention.
Olga, thank you very much. And dear competition committee, your question, please. Oh, we have the question from the participants. So maybe firstly we will listen to our jury, and then we will move to the questions of participants. Okay? So is there any question from our jury? No. So the question from the participant, Taman, is, yes, please ask. So ask the question. Taman.
Hello.
Yes.
So I want to ask, what was the major clinical sign difference you find between the vaccinated patient and those who are not vaccinated?
Sorry, can you repeat your question, please? What about clinical signs?
Yes, I can. So what was the major difference on the basis of clinical sign? Like the main one you find between the vaccinated patients and those who are not vaccinated?
Like main difference, you mean, between unvaccinated and vaccinated patients?
Yes, on the basis of the clinical sign, like the one clinical signs you can differentiate.
Okay, we can say that there was difference in the rash, in spreading the rash. It was more abundant in unvaccinated patient, and it was accompanied by itching of the skin. Also, we can say that in unvaccinated patients, we had an enlargement of occipital lymph nodes more frequent, significantly more frequent. And also in unvaccinated patients, we met dyspeptic syndrome as vomiting and diarrhea also.
Okay, thank you.
Thank you for the question.
So anyone else, please? No question?
The question, please. Can I ask the question, please?
Yes, of course.
Oh, it's Victoria Hamazuk. My question is, do you find some difference between the outbreak in 2018 and previous outbreaks? Because this is in your test, please.
Difference in outbreaks and okay, I understood your question. We can say that this outbreak is characterized by a significant increase of adult population in the structure of the disease. We had more cases with adult patients, because before there was a lot of children. Now we have a lot of adults in such in this outbreak.
Okay, thank you. And one more question. What was your personal input in this work? What did you do personally? Did you examine the patients?
I was working with some patients, but mostly I was working with different data, with histories, with cases histories, with analysis, and sometimes, yes, with patients.
Thank you.
Thank you.
So, thank you very much. Any questions? No. So Olga, thank you very much.